Hello guys, my name is Bahati Jean-Paul. I'm studying in Southern New Hampshire University through Kepra program here in Rwanda. So I've been learning the module called social media in healthcare. So today I'm going to talk about the evolution of social media, the importance of using social media, and the reasons why the healthcare facilities should train their healthcare providers about using social media. So let me start up talking about the evolution of social media. According to Jones 2016, social media has been used for a number of years, and healthcare providers have been using Henry Ford Health System in 2009. Mainly it was used in surgery, but it was aimed also to be connected with the patients. So it has been noticed that it was used in Seattle Swedish Hospital. However, from 2012, there was a strong domination of social media in healthcare settings up to now. So these days, almost every healthcare organization has a social media presence in one form or another. They vary significantly in terms of growth of healthcare facility. Mainly it is used for converting unknown consumers into patients. Around 60% of internet users look for health information online. So social media is an abundantly helpful tool that providers can use to convert unknown consumers into patients. So the job of social media is to start conversations with consumers using forms of outreach they are already using to correct health information. So social media has an impact to the consumer behavior in the same way that any great conversation with a trusted advisor does, because social media provides an opportunity for healthcare organizations to demonstrate thought leadership on today's most pressing healthcare topics such as diabetes, obesity, and wellness. So, through the dissemination of medical information that is accurate and actionable, healthcare organizations can not only improve general healthcare and well-being, but it can also grow patient rosters and the bottom line as a result. So, however, these days social media and healthcare associated also with the privacy concerns, because we have what we call the HIPAA as a rule protecting the privacy and the confidentiality of the patients. But due to the lack of training of healthcare providers into collaborative technology, they violate that rule. So, uh, you can ask yourself the importance of using social media in healthcare. According to Quinta Pediatrics 2013, social media helps healthcare professionals to engage with others online as the potential to make them as a good healthcare providers. So this are achieved through sharing the experiences and the skills online. So the second important, social media helps in transportation, what we call the communication between the patients, because social media provides a convenient and a link between the patients and the healthcare providers. So this achieved through chatting between the patients and doctors. So the last but not least, social media helps to connect doctors with the other doctors involved in the same career, because the doctors, it helped them to understand the conditions better through social media, because they achieved that by asking questions their fellow doctors about the specialist, or about the questions they have, and they get answers to those questions. So uh, those are the importance of using social media in healthcare. So I'm going to also to talk about the policy, the social media policy. So why do the healthcare facilities, they can train their health providers about the effective use of social media. So when you are going to create a policy, you need to, first of all, to have a goal. So according to Sharma 2019, uh, he says about the first steps you can make to have a good use of social media in your organization. First of all, you need to have, or you need to define your goals. So without a goal in your mind, it will be difficult to channel your efforts to reach it, because uh, healthcare facilities need to have a specific goal that explains what they want to achieve. That is the first step of Sharma. The second step, he says that you need to define your target audience, because you need to determine the content you will post based on the audience you have. And you need to remember that the audience you have, uh, they are patients. They are the people who are sick. And the third step is that you need to choose the social media platform. You need to determine which social media platform is used by your target audience most. Because let's take an example in Rwanda. We know that most of the Rwandans, they use Facebook, which means that you cannot use Snapchat, though you know that most of people use Facebook. So the last step, it's about auditing your performance. Once you have started posting content regularly, you need to vary, or you need to audit your performance by comparing your follower bases, your engagement with your competitors. That's how you audit your performance. So in the policy, or like in the reasons why you need to train your employees about the effective use of social media, we have the restrictions that govern the healthcare providers' activities. According to the United States Department of Health Human Services, in 2009, there are some of the restrictions to the healthcare professionals against the use of social media. So, first of all, if you are a healthcare provider, it's not allowed to post the individually identifiable health information, including demographic data. Again, it is not allowed to post a document or any other representation of the research made by another healthcare provider. That is the second restrictions according to the United States Department of Health Human Services. Again, the third restriction, it is not allowed to post the information of the group health plans enrolls for the plan sponsor to perform plan administration functions. So those are the restrictions that guide the effective use of social media in healthcare settings. Again, in the policy we create, you need to tell your healthcare providers what they should do and what they should not do. According to Udemy 2020, uh, for the things healthcare providers should do, they should post their ideas and opinions to the healthcare institution social account. And they should talk to the media when they have a permission from their employers. For the things they should not do, it is not allowed to post on behalf of the other employees, especially to the healthcare institution's social healthcare account. Like if you have many employees, and then you find that someone may post on behalf of the other, it's not allowed. And again, you should not post any kind of information to the account of the healthcare institution social account without consulting the codes of practice in an organization. So you should not also post the information of patient to the healthcare institution social account to protect the patient's privacy. So regarding to the protecting of the patient's information, I would recommend the healthcare organizations to use these advices if they want to be secured. So the first advice I would recommend the healthcare institutions to install secure hypertext transfer protocols like SSL and TLTRS to avoid network attack surfaces. According to Wood, an organization should have the hash functions which will keep the identity of your password and protect the threat agents to hack that password. Again, the second recommendation, I would recommend healthcare organizations to confirm the identity of end users by attaching a verified mobile number at account registration, because phone numbers of intelligence can be provided to evaluate the potential risk of the end user. This would address the challenge of the creation of fake accounts that spreads the fake news about the disease prevention. It is recommended to use verified number according to Telesign 2020 because it also like it can prevent that problem of hacking the organization's account. So this is what I've planned, and I'm requesting you, if you have any other suggestion, to drop it in a comment box. Thank you very much.